Welcome to the second episode of Life, the Universe, and Being a Veterinarian. I'm Dr. Tanya Grantham. In this episode, I'm going to be looking at the art of medicine. Art and science. I hear you question whether they even go together. Aren't they mutually exclusive? And my answer to you is a very resounding and loud no. Before I put together these videos, I do a fair amount of research and reading. I have an idea of the things that I want to say. And sometimes, or one of my flaws is that I overthink matters and I can be a little bit stilted. But today, despite the research I've done, I'm going to go with the flow and let's see how it pans out. I looked for a number of definitions. The first definition I looked at was, how do we define art? Art is the expression or application of human creative skill and imagination, usually expressed in terms of a painting, a sculpture, something, a piece of music, something that we have come to view as artistic. I then looked at what is the definition of the art of medicine. And unfortunately, I found a lot of clinical definitions for the art of medicine. And so one of the definitions I found was it's the clinician's way of being when interacting with patients and clients. My definition of the art of medicine goes a lot deeper than that. And it ties in again with my calling to be a veterinarian and the way in which I express myself within my chosen field, but also it has to do with where do I find the joy within my calling and within my profession? Because ultimately, we should be finding the joy. I came across another definition which dates back to the Grecian times of Aristotle, and they sometimes refer to Plato when they talk about phronesis. This is practical reasoning. So as vets, we all develop practical reasoning, plus wisdom. One hopes that with time we develop wisdom, which is based on science and experience and judgment. I would like to add to that I think that our intuition also plays an enormous role in what I believe is the art of medicine. When I was a new graduate, the term art of medicine never even entered my mind. Only as I have been through my various stages of development as a veterinarian, have I come to realize and appreciate that I'm an artist within my profession. And I'd like to delve into that a little bit more and expand on it. If you're a younger person listening to this, perhaps it will help to shape you and move you in a direction. If you're somebody who's a little bit more mature and a little bit older and has some life experience, perhaps you are already expressing your artist within your chosen profession. And to that, I would say, yippee, let's do a celebratory dance and go, fantastic. We are living life. We're filled with joy. We're having a great time. And we're enjoying the experience of being a human. Which brings me to the most important point that I'd like to make about the art of medicine. And that is an absolute need to embrace your humanness and to be human in your interactions with your clients and your patients. In this new age of technology, I see how veterinary medicine has changed. When I was in my second to last year at vet school, we did a subject called radiology, but in actual fact, it is a topic that has now become known as diagnostic imaging. In other words, what do we have at our disposal, like radiographs, like X-ray photographs, that give us information or give us an image that assists us to make a diagnosis? I went back to my notes and discovered that I had literally about 4 pages of notes on diagnostic ultrasound. Move on now, 30 years from there, And diagnostic ultrasound is a mainstay of veterinary medicine. It's a mainstay of human medicine. But as taking x-rays, x-ray photographs was so important when I was studying, it still is important, but now we have additional access to imaging. It's technology. So we have ultrasounds, and we have MRI scans, and we have CT scans, and we have way more availability of blood tests and all manner of genetic testing that was not available 30 years ago. And the tendency that I see is that we as a profession, I see it in the medical profession, and I see that that moves over into the veterinary profession, is that we have this need or this tendency to depend on our testing and our diagnostics. And I believe we have forgotten the art, or perhaps we don't practice the art anymore, of history taking, of discussing with the client, of palpating and really observing our patients. Palpation, the ability to feel something within a patient, is an art. It develops with time and with experience. What I'm suggesting is that our dependency on technology means that, or in some instances, it looks as though the diagnostics that we have access to are insufficient, and we are, in many cases, unable to come to a diagnosis or a correct diagnosis. If we're able to incorporate our human skills, then I think we start getting a combination which is a win-win for everyone. It allows me as a veterinarian to feel that I am useful and capable, and it brings in the technology that gives us more information. And the moment we can marry the information that we get from the technology with our experience and our clinical skills, then we're starting to look at the art of medicine. To consider the art of medicine in a little bit more detail, I want to run through a few things that have helped me in my career. And as I move into this new phase of this next iteration of my title of veterinarian, and I look back, I realize that a lot of the things that I'm going to mention, I was doing instinctively in my younger years, despite not being conscious or aware of what I was doing. The first thing that I think is important as a practicing veterinarian, or as anyone, is to understand and appreciate what is your intention, or to set an intention. There are many spiritual practices, in fact, where there is a practice to set an intention at the start of every single day. An intention like, I'd like to be the best version of myself that I can be today. And as we hold that intention, it starts to affect an imprint on every action that we take during the course of that day. So my intention when I started practicing as a vet was very simple and very naive, but very, very powerful. My intention every day and with every patient that I saw was, I really want to make this animal feel better. And I used whatever I could, whatever I had at my disposal, to improve the well-being of that patient that I was treating. So intention is very, very powerful. The second aspect of moving towards an artful existence within your scientific profession is really to connect with your patient, which I think as vets, we all are actually well versed in. One of the things that we perhaps are not so competent in is connecting with the human that brings the patient in. So connecting with the animal guardian or the pet parent, whichever term you choose to use, I prefer. It's very important that you find some way of connecting one human to another human. Part of that connection, which we'll run through a few of them now, but part of that connection is to develop the ability to listen. It's very important to take a good history. I find that the more I listen and the more information I gather prior to examining my patient, the more accurate I am with my diagnosis and the better treatment program I'm able to develop for that patient and for that family. So I am in physical rehabilitation now, which makes the treatment choices different to my dog has babesiosis and now I need to treat the biliary. Okay. Develop the skill to listen and really listen. And part of listening is to be open. We learn about a term. The term is idiolepsis. And idiolepsis, just a reminder for the vets that are listening, idiolepsis is zoning in on what you think the diagnosis is. So a dog has been hit by a car, it comes in, it has a fractured leg, and to the exclusion of the rest of the dog, you focus on the fracture of the leg. And you miss the fact that there are rib fractures and, potential chest damage. That's idiolepsis. And if we are not open and we make a decision based on limited information, we run the risk of missing something. So I would ask you, or I would say, as part of the art of medicine, 1, listen. Number 2, be open and do not make an assumption. Assumptions or assume makes an ass of you and me. So rather reserve judgment, don't make any, and be open to whatever it is you may perceive, see, feel, smell. You have 5 senses, and we should be using them all in the consulting room. So for a quick recap, number 1, intention. Number 2, listen. Number 3, be open and don't make assumptions. The 4th thing that really has helped me and helps me every single day, it ties in with being open, but it's a little bit more than that. It's be curious. Ask questions. Learn how to communicate. Learn how to ask an open question. So those are things like, how did this happen? Why? When? They are questions that require a longer answer. Closed questions are questions where the answer is yes or no. How do I ask questions in order to gather information with the aim of making me or allowing me to develop into a better diagnostician and a better veterinarian? And the more information you gather, the more this information, when it links with the diagnostic testing, the more accurate you're going to be in terms, along with the being curious, along with the listening, along with the being open. Really, it has to, as I said earlier, it has to do with being human. What experiences do you have that you can draw on that ease matters in the consulting room? Most of the clients that come in when they have an animal that is ill are very stressed, very emotional, very uncertain because they don't know. If you hold that within yourself, a lot of the rudeness that we experience and a lot of the abruptness that we are exposed to, you can begin to feel, you can begin to be compassionate towards the client, towards the person, towards the human that is standing in front of you, and move your own pride and your own ego out the way. So find a way to establish a rapport and start with the non-traumatic incidents, start with the vaccinations, start with the routine checkups, and build a relationship. Give them an example of something that's happened in your life. Find some point of connection. The other thing that the storytelling and the openness helps to establish is trust. And trust is imperative in terms of the veterinarian client patient circle, triangle, and bond. The final aspect of this discussion that I'd like to mention that is going to assist you enormously is intuition. As you examine your patient and as the conversation continues, I hope, be open not only to the hints and the bits of information that your client gives you and that you pick up from your patient, but be open to your own inner sense of what is happening. We are scared out of our wits, literally, when we hear terms like gut feel. So I'll give you an example. Right. I was consulting in my capacity as a rehabilitation practitioner, as a rehabilitation vet, not in private practice or small animal practice anymore. And my patient was a middle-aged German Shepherd. And the client had brought him to see me for a hindquarter weakness, which is quite typical when they get to about 7. She started to talk to me about, she said her dog, when he eats, he starts to look uncomfortable and he starts to shift his weight, and he then moves away and doesn't finish his meal. And she wanted to know if this was related in any way to the weakness. And it would be very easy for me to say, yes, absolutely. I mean, the dog is starting, maybe he's a bit painful. I don't recall all of the details. Maybe his musculature was becoming fatigued, and so he needed to shift and move, and he felt like he was unable to finish his meal, and it looked like he was getting uncomfortable. And I recall for me, it's simply a knowing. And the next question, I said to her, has your dog suffered a gastric torsion? And she looked so surprised. I was surprised. It wasn't what I anticipated. And she said, yes, he had. And I said, and he had surgery? Yes, he'd had surgery to correct it. And he'd had a gastropexy, which is where vets tack the outside of the stomach to the lining of the rib cage to try to prevent it from turning again. And we want to get some scar tissue to hold that stomach in position so that if the tendency is there for another torsion, there is a physical attachment that prevents the stomach from turning. I then went on to ask her, how frequently does she feed her dog? And she fed him 1 large meal a day. And so my suggestion to her was, rather give him 3 smaller meals, because the large meal was stretching the stomach too much, and that I felt that it was actually stretching that scar tissue, because scar tissue is inelastic. It doesn't stretch very well. And let's see if that doesn't assist in reducing the symptoms that were present. And lo and behold, the next couple of weeks later, when I saw her, because the dog came for therapy, and I asked her if she'd done that, she said yes. And I said, and how is he doing? And she said, surprisingly, his discomfort was no longer evident when he was eating. So I mention this story because it wouldn't have been a normal question, but I was prompted by my intuition to ask a question which was seemingly unrelated to the reason the dog came for its consultation. And yes, that does come from years of experience, but I would urge you to trust your intuition. When I'm talking about the art of medicine, it is all those things. It is the testing, it's your examination, it's your history taking, it's your communication rapport with the client, and it's your experience and your ability to trust your instinct, your intuition, your gut feel. I would urge you to start embracing that aspect of yourself. I'm going to end with a quote that I discovered when I was researching this topic. The quote goes like this: "A good physician treats the disease. A great physician treats the patient and the disease." I would go one step further and say that an absolutely fantastic physician treats all of that and also is able to access and experience the joy of their own being while they are treating and practicing within their professional capacity. As always, thank you for choosing to spend this time with me. I really do appreciate you. So much love.